the different muscle pattern that fires after you have an ACL deficiency. It actually changes your brain pattern. So you're going to see on my VMO right here, a little bit of a lag. It's a little soft when I contract it. So I try to do some VMO exercises, squats, hamstrings, and we do some VMO specific exercises. But sometimes you need a little bit more engagement. Let's take a look at the brain pattern that happens after this ACL injury.
Red is the ACL activation pattern of our ACL patient, and in blue is the brain activation pattern of a healthy match control patient. So you almost don't have to run the statistics to do that simple quadriceps dominant knee extension task. You can see our ACL patient engages in a lot more red than blue. They have to bring in a lot more brain regions. They have to activate those regions with a higher degree, more rate coding, more neurons firing than our healthy matched control patient. Which the data you're seeing is just one patient versus another patient. And these were the Division I collegiate level soccer players, and the young lady was returned back to her sport. So the lady in red, she's playing Division I collegiate soccer, but she has to activate all of these accessory brain regions just to generate a quadricep.
So use it or lose it, I always like to say. You can see there's a little deactivation that occurs after these injuries, and it becomes habitual. So I'm going to use my PEMF machine that I happen to have in my office. I'm going to get a little activation. I'm going to start this at about 35 on the intensity. I'm going to just try to reorient this so we have it at a little bit sharper angle for you to see what's actually happening on the knee. You'll see a little vibration. That's as the muscle itself is being activated. Little slight pulsation of the muscle. There we go. Now it's tightening up a little bit because it's a faster frequency. What we're going to do next is the shock wave. We're going to work a little bit more on my joint. Brand new Mercedes right here. We got to take it up. This is the soft wave. There's the brand. Yeah. This also has coverage for wounds, and we're going to get this baby activated. We're going to start up the fill process. Now when we finish, we got to drain the fill. It kind of looks like a flashlight. I call it the Statue of Liberty play when we finish, but it's starting to fill up with the water, which serves as the vehicle for the shock wave. This is different than the pressure waves. I own one of those as well. Another good machine. You're going to see the lip there, and we filled up. Now we're going to double pump engage this. I'm starting at a setting of 9. I'm going to double click this, and away we go. Here we go. It's a little intense. As they say, no pain, no gain. I am going to take it down a little bit. We're at level 9. It is getting a little mild irritation.